Hi, everyone. Can you hear me? Good? Okay. So today I'm really grateful and excited to be talking about adult autism throughout the entire lifespan of adulthood. I'm really also going to be talking a lot about mental health and a brand new program that we're starting here at the Weissman Center within the University Center for Excellence in Developmental Disabilities. So my name is Madeline Barger, and I'm a family therapist and a behavior analyst and a nationally certified sex therapist. And I have been in the world of autism for the last 17 years, most recently 10 years here at Weissman. And during that time, I learned a lot about treatment and intervention for mental health challenges and how to make adaptations. And I worked as the lead for adolescent and young adult support services within our Weissman autism treatment programs. So I'm going to make a note on language. Familiar with this, but I'll use both identity first and person first language today because that reflects the wishes of the majority of my clients. So as an example, I might say autistic person, which is identity first, or I might say person with autism, which is person first. So I use those interchangeably. So most recently here, we have an announcement to make and then also some information about the journey of this labor of love to share with you. So we are starting this program that will be made by and for adults on the spectrum. And this I've accepted the role as director of this program, and what it signals is a really significant development in the history of the services here at the Weissman Center. And I want to start by saying this journey began with all of you. Many really supportive, familiar faces are here. But people on the spectrum through adulthood in our community, they call us, they email us, they participate in research, and they participate in community outreach just like this. And what they tell us on the whole is that much more attention must be paid to adult autism, not just young adulthood, but through the whole life course. So we hear you, and that's why we're here today, talking about how we got here. So when people, for example, call our resource line, their adults on the spectrum in particular are calling and asking for age-appropriate community resources, but not just asking really good questions, also giving really good feedback about how there's so few places to go, or that you kind of have to be in the know to find a person who knows a person to get the right services. And here we're clinicians and researchers, so we want to ask why, how did we get to this place, and not make assumptions about how. But I talk to mental health clinicians, for example, around the country, and what they share with me is that they may have very little training in neurodiversity or developmental differences or disabilities. So while they're able to diagnose and treat mental health challenges and they feel expert in doing that, they really may struggle with understanding those in the context of somebody on the spectrum. Now, in our state here in Wisconsin, on the other side of the coin, we have autism providers, and they know about developmental differences, but they never have worked with an adult before. So they may often be trained only in the pediatric lens. And because so much of our research and our funding, for good reason, goes to children and adults, the emerging clinics that come from that research and funding are often pediatric clinics. And then we know there are very few, but those that do include adults often include adults as an add-on or through the lens of pediatric development through young adulthood, rather than a program made by and for adults. So I'm sharing this because I really want you to understand this labor of love in the context about how we got here. And so we know there are really many unmet service needs in the adult autism world. But we want to focus as an example, we'll zoom in to thinking about mental health a lot today, but we know there are many examples. So for mental health in particular, people on the spectrum report higher rates of dually diagnosed or concurrent diagnoses of mental health. And what they're telling us is that they can't find a provider or a therapist. And sometimes when they do, that therapist may discharge them or refer them out because they don't feel comfortable working with people on the spectrum. They just don't have the training. Or they might not understand that they are really great clinicians, are really capable of adapting their interventions. And I'm going to give you some examples of that today. So what we want to do is encourage people to learn and not assume that they can't support this population, because it's really incredible work and rewarding work. What we know is that the whole, whether someone's on the spectrum or not, they do benefit from when their clinician has learned neurodiverse treatment adaptations, because it allows you to have the skill to meet any person right where they're at. And it's really important to reduce ableism in the therapeutic environment. So it's an effort that's important. So to that end, I'm sharing with you all that we will have, for the first time ever, an adult autism program here that is made by and for adults on the spectrum. And I'm gonna advance our slide. We did it, okay? So in order to do this, we, of course, if we know any lived experience, any clinical experience, and any research, we know that we have to be thinking about transitions across the whole life course. So a program that is made by and for adults on the spectrum would, of course, be informed by life transition. On the next slide, I'll share with you a citation from Laxman et al. And our Leanne, who spoke and invited you all here today, welcomed you all here, authored this paper as well. But what this paper is, a longitudinal study. It really supports the work that I see in my clinical work about the challenge of all these life transitions for people on the spectrum. And in particular, the way that autism symptomology interacts with environments that are not neurodiversity friendly can create really significant stress around life transition. So when we think about transition, what we think about is that it's hard for all of us, right? So we think about often transitioning out of high school. That's what a lot of the conversation is, and what's next. So it could be maybe college, maybe work, maybe not. Maybe daily living routines get changed and developed. Maybe living arrangements are going to change. But we also want to be thinking about the people who desire to have intimate relationships and partners, and maybe families, and to parent. And we don't want to forget about what is it like to retire, and how might that be different if you're somebody on the spectrum. We also want to be thinking about, how do you care for aging parents if that's the case? And not only the development and maintenance of relationships, but over the life course, relationships change and they end because people of significance in our lives can pass away. And so having some sort of support system that's evidence-based and neurodiversity friendly is really important for helping with these life transitions. So what we know is that from youth to adulthood, there are many adults on the spectrum who call us who have no services. And in the literature, we call that the service cliff. And so it would stand to reason that there's even fewer supports for middle age and adults nearing sort of older age and end of life to get their needs met. So we care about this, not just because we don't want people to hurt and not have what they need, but we care about it because it really has this ripple effect for people's lives and for really our world. So without support in looking at life transitions, we can get long-term stress, which means we're not just looking at concurrent mental health diagnoses, we're also looking at mental health crisis, such as inpatient experiences. We might be looking at unemployment, at financial challenges, at legal challenges, which could involve misunderstanding of maybe some behaviors. And we also are looking at family navigation challenges. How do I, as an aging person with developmental differences, exist in my family system in different ways? So that's really important to be thinking about. And why we're zooming into the mental health lens here is that autistic adults really provide the whole world with a unique and remarkable perspective on the human condition. And mental health professionals, when they're trained well, can have an enormous impact, not only toward adapting these interventions, but towards looking at a person in the context of their whole life system. So not just mental health, like depression and making depression feel better, right? But also who's this person? What are their strengths? What does their life look like? What transitions are hard for them? What does their family system look like? And we want to be developing intervention adaptations that put choice and self-determination at the forefront, and also support mental health clinicians to feel confident looking at self-love, self-esteem, self-efficacy, and relationships. So that those things are not just sort of reserved for people who are otherwise doing pretty great. So we want to have those be what our standard is. And many of you in this room are really familiar with this, but I do share this because sometimes people aren't aware that almost every adult that I've worked with has reported some form of a concurrent mental health diagnoses, and often ADHD. And these are the common ones that we see. And remember, that's not because autism causes a mental health problem, right? That's what Katie and Lily were talking about, causation versus correlation. It's because the environment is not set up to be easily adapted, and that can cause chronic stress. So what we see here is anxiety and OCD, depression, and mood disorders. And many of you may be familiar with how frequent those arise as diagnostic profiles for people on the spectrum as they age. However, what's really interesting clinically is the number of adults that come to me, in particular women in their 30s and 40s, but I won't get into the weeds there, but lots of misdiagnosis happens, lots of it. So an adult may come in with anxiety and they have maybe the personality disorder diagnosis or a different diagnosis. And mental health clinicians are sharing with us that sometimes they're not sure how to differentiate between mental health symptoms and autism symptoms if they don't have the training. And adults are telling us, well, my anxiety, I'm on the spectrum and I experience the world differently. And my anxiety looks different than my parents' anxiety or a neurotypical friend's anxiety. So the presentation is also really different. So we want to be equipping a lot of clinicians, not just mental health providers, to be able to adapt their interventions. And so we know the adult autism population is growing, and that's a good thing because it means kids are growing up, and that's really important. And we know we can predict that there are going to be high rates of stress around transitions, and that will result in co-occurring mental health challenges. And we want to be able to look at this as part of how we train people to work with neurodiversity rather than just an add-on or an afterthought. Additionally, adults on the spectrum report really significant stress on the whole. So sometimes there's fear about accessing treatment to begin with because they may assume, and rightfully so, that they'll have to educate their therapists about autism or that they won't be understood. And it'll be another experience of sort of being marginalized. And so some adaptations, and we could talk for hours about what they are and how to do them, and we will over the course of the next few years, but just a list for us to be thinking about of things we can adapt. We can really be looking at not just back and forth talking as a way to do mental health sessions or any appointment. So we want to be thinking about how do we use a person's unique communication needs and adapt for them. So that could be visuals, written lists, social stories, video models, role plays. And we could be thinking about also alternative and augmentative communication for non-speaking people. And how do we learn these and integrate these into our interventions so that a mental health treatment for depression, for example, doesn't just work for one kind of person, right? We need it to work for lots of people. Other adaptations that adults have called and told me are really helpful, role plays in particular, but also longer treatment sessions, longer duration of overall service, really concrete language and examples, and a super clear process for asking questions, for pausing therapy, for getting things clarified. Also, throughout adulthood, we need to be getting creative about what does family mean? Sometimes it's biological, sometimes it's chosen, sometimes we need our family to join us in therapy, but we need to be really flexible about what does that look like and how is that going to go. And finally, we want to think too about creating sensory-friendly clinical environments. And that is individual. So there are people in here who are incredible, who have come through our spaces and said, I need this, this, and that. And we go, great, we're going to do that. So we want to teach clinicians to do that with everybody because we should all be thinking about sensory-friendly environments. So what an autism program here looks like is not just serving the autism population through the whole course of adulthood, but we also know we have to train providers to build statewide capacity so that they're able to do differential mental health diagnosis, that they can adapt their interventions, that they can understand progress monitoring differently, because when someone has a developmental difference, they may view progress differently. We also want to encourage providers across the state and the country to understand that they may really be good at what they're doing and make a few small adaptations, and we could really increase access for people. So this is the mission that we will embark on. And I'm going to try to not cry when we do this next part. I've been doing this work, as I said, for 17 years, and a lot of the work is not just in the session, it's outside of the session, because I have worked in many pediatric spaces that we are advocating for those spaces to include adults and to keep including adults and to include more adults. So this program is a really significant change in that area. And so in that context, over the years, I've received many letters from adults on the spectrum, whether they're seeing me or seeing someone else, telling me what they need and how things are going. And I'm going to share with permission, and I won't share their name, but they've asked me to share this, a letter from somebody that I have worked with for a long time. And they wrote this in particular for two reasons. One is so that people can understand the mental health challenges that people on the spectrum are experiencing from this person's voice, and also so that you can really hear the fear in not having a service provider. So this person can see maybe 1 to 3 people that they are comfortable with. And what our goal here is at Weissman is that people on the spectrum will be able to have lots of doors open to them to get support over time. So it says, read this. This letter is titled Thoughts and Concerns and Quality of Life Important to Share. So my therapist, Madeline, is the most helpful person in my life. She's working with me on transitioning from college life to life after college. This transition contributes to my biggest anxiety since changes are very frightening to me. We have been working together on resources that are available to me after I graduate from college. Most importantly, I get ideas about how to maintain a social life so I don't feel isolated, lonely, and depressed. We're working on how to evaluate relationships in my life. Who can I trust? Who are my true friends? And how do I not invest time and energy into negative and emotionally draining relationships? I have that question too. This is a good question. I would like Madeline to continue therapy with me, as she's the only person that knows me very well and can connect with me on a deeper level. She understands my struggles and social anxiety. Throughout my life, I encountered friends I loved, friends who left me, and people that see me only as their colleague, people who don't even like me. However confusing navigating the social world is for me, we find ways to help me see the bright side of my life and live as normal a life as I want to. Without Madeline, I'm afraid that all my progress towards improving my quality of life will be for nothing. So what we really hear in this letter is a nod to several mental health challenges coming right from the voice of a person on the spectrum. They are experiencing anxiety and depression. They're experiencing a risk of loneliness and isolation, fear of the social world. And what we hear if we zoom out is that a person in our state really needs support, and it would probably feel a lot better if they felt like they could go to a lot of different places to get the support and not just one place. So our task here at Weissman that we're next embarking on will involve not just the service, but also training and disseminating model service throughout the state. And that brings us to sort of a summary of our plans. So this adult autism program here at the Weissman Center will provide services created by and for the adult autism community in our state. Unlike many services that are designed for pediatric clinics, there will be no age limit to this service. We will offer group and individual services focused on family and individual mental health needs, life skills, lifespan transitions, social connection, and peer mentoring. The program is informed by research done here at the Weissman Center, including curricula that were developed here that many of you are familiar with, transitioning together and working together. And then many of you in this room really helped me with a quality improvement project, Advanced Adult Relationships. And so we'll be using those to name a few. We will also be supporting family navigation so that any adult in our state can call and access resources that are available. And current data from the resource line shows that people on the spectrum are calling looking for lots of different things, but some of the top things are mental health support groups, peer interactions, and mentorship. And they would like providers to be autism trained, aware, and inclusive across all disciplines, so mental health clinicians, physicians, and even dentists. And given this broad need for supportive services, not only will we provide adults and their families access to the service, as I've told you, model services, but we're going to offer consultation and support to build statewide capacity. This will include community trainings, professional development, coaching. We want to grow skilled professionals in this arena. And the program will also both inform and conduct research related to adult autism supports. And this really aligns with our mission here. It's an iterative process of research informing practice and the community informing research and service. And so we are living here, but hoping to launch things out into the world to support more than just people who can access us here. And that aligns with the mission of our University Center for Excellence in Developmental Disabilities. So to that end, we will have listening sessions today at noon. If you are registered, you can come. If you're not registered, I believe you can still come and we'll figure out how to register you. Mary Ann's nodding, so that's what we'll do. We will meet around the corner in A120. and then go up together for a noon listening session, and there will be lunch. But note, if you can't make it today, that is totally fine. We're going to have a lot of these. And today is just anyone who can come, but we'll be doing specialized listening sessions for the different groups listed up here, including autistic adults, perhaps parents, families, partners, community, and then providers throughout the state. This link here, and I'll leave it up after I finish so that you can click on it if you want, but this is how you can register. And then not only do we have it here, but this QR code lets you get in touch with all of us. So you can fill this out and let me know your contact information. And if you want to receive services, inform services, or if you want to be on a listserv to get our updates as we develop and grow here. And this is also on the website. So if you just Google Weissman Adult Autism Programs, you will find your way to this. So I want to say thank you and leave any room that we might have for questions for time. 1 to 2 questions is great.